Let us discuss Warthins tumor, its name, definition, and its etiopathogenesis. In all these pictures, we are seeing swellings which are located posterior to mandible and below the ear. These are round or ovoid swellings. These are asymptomatic and are not very large in size. These are common in males and seen after fourth decade of life. The swellings are nodular. The consistency is duffy or sometimes rubbery. In 1895, these swellings were called as congenital epithelial cysts of neck. In 1910, two cases were reported and were termed as papillary cystadenomas in lymph nodes. Coming to name of the tumor. Histologically, three important components are seen. Lymphoid tissue, one is epithelial layer, and cystic spaces are seen. So, different names were proposed. Adenolymphoma, cystadeno lymphomatosum, cystadeno lymphoma, and papillary adenoma. In 1929, Warthin described this tumor and called it as papillary cystadenoma lymphomatosum. After his name, it was called as Warthins tumor. Coming to definition of Warthins tumor, it is composed of bilayered, columnar and basaloid oncocytic epithelium that forms multiple cysts. And also it is accompanied by lymphoid tissue. The etiology is unknown, but risk factors are smoking, Epstein-Barr virus, autoimmune diseases, and radiation. Warthin's tumor is associated with smoking. Many studies indicate that it is 8 times more frequent in smokers. About 90% of Warthin's tumor patients are smokers in many studies. So, there is positive correlation between smoking and Warthin's tumor. But the question remains whether irritants in tobacco smoke cause metaplasia in gland or not. Coming to etiopathogenesis of Warthin's tumor. Many theories were proposed regarding its origin. Brachygenic theory states that it arises from remnants of branchial pouches. The delayed hypersensitivity theory proposed that Warthin's tumor arises from inflammatory response secondary to epithelial changes. Eustachian tube theory says that Eustachian tube endoderm gives rise to Warthin's tumor. But all of these theories were rejected. Some other theories regarding origin of Warthin's tumor are lymphocytic infiltration theory, which says that epithelial proliferation occurs in glands, which leads to lymphocytic infiltration and incorporation of lymphoid tissue. Another theory states that there is induction of cystic and oncocytic changes secondary to inflammatory infiltrate. At present, most accepted theory of origin of Warthin's tumor is heterotropic salivary gland duct theory, which says that there is entrapment of salivary ductal tissue in lymph nodes, which occurs in intraparotid or paraparotid region during embryogenesis. I will discuss clinical features, histopathology, differential diagnosis, and treatment in next session. Thank you.